to encourage young people who are studying homeopathy, with how many polycrests can you cure 70% of the patients, you think?
This is an interesting question. I mentioned throughout the day, my uncle used to tell me, if you know only 50 polycrests, you'll be a good homeopath. But you have to understand those polycrests like a mother knows her baby. So understanding those polycrests are important. But I will say for my young homeopaths that don't get confused, don't get exposed yourself to hundreds of different ideas. Stick to the foundation, stick to the basics first. Grab organon, understand the classical aspects, study the Mathematica, because also homeopathy or the totality is not a quantitative totality. It's not 2 + 2 + 2, 2, 2 is the quantity, is the qualitative totality. The qualities of the person should match with the qualities of the medicine. So when you study a polycrest, try to understand the qualities in that personality, in that polycrest, and that's quite important. And my young homeopaths, homeopathy is a wonderful, wonderful science. And in order to understand that, you need to see patients, you need to see cases. I'd like to invite to India. We run a course in January where we show 200 live cases in 2.5 weeks. And most of these cases are advanced pathology, and we show how homeopathy can improve. And this gives a lot of confidence to young homeopaths. We get a lot of young homeopaths coming to get that confidence, because that's the real homeopathy which works in advanced pathology. And believe me, you have chosen a right decision, right career, and homeopathy can really, really help the mankind.
Because you practice in Harley Street, London, not the place for the poor, and you have a practice in the slums in India.
That's the diversity of homeopathy as well.
Yeah.
And that's interesting, because in the slum clinic, it's free of cost, and I think I balance my internal satisfaction in that way. Janett and I go to India to give our time to these slum people, and they get benefited by that. Janett does quite a few balls in England to raise money.
Parties.
Yeah, ball parties to raise money for the charity. So in that way we support the charity. But as a profession, I like to show, yes, homeopath can practice in Harley Street. Homeopath can charge good amount of money. If the patient gets better, patient will come and give you that money, that amount of money. And obviously, patients are not idiot, patients are not fool. They feel better, they recommend patients. In England, it is very, very difficult to survive as a private practitioner in homeopathy, because it is governed by NHS, and NHS is free. But still they come to homeopath, pay money, pay a good consultation fee, because they are benefited by it.
Okay. And Janett, you give attention to the personal development as a therapist?
For students, yes.
Yeah.
So that they're aware of who they are, how they want to be as practitioners, and how they can identify and separate themselves from the case they're in front of. Because quite often we need to separate what is normal and what is unusual. And if we know ourselves, we can separate what is in front of us, because we have to be an unprejudiced observer. My job is to help students become practitioners, and we do a lot of work on being unprejudiced, understanding ourselves. But this is done in the classroom through discussion, through understanding case-taking in its purest form. We are the bridge between the patient and the medicine, and so our case-taking has to be very clear and thorough. And by knowing ourselves and knowing the style in which we want to practice, and also how we learn, we can improve our learning, improve our time in college. So we don't incorporate any other method of learning or finding out who the patient is, no NLP or psychotherapy, because the medicine is so deep and thorough, that we don't need hours of counselling. The medicine will allow that patient to develop in its own time, without soul searching, without finding out what damage the parents may or may not have done. So we need individuals as practitioners who know themselves and can behave professionally and survive emotionally from hearing stories.
Medicine will speak, because if the medicine is correct, it will set the dynamic energy in the right direction and it will improve. And we will be amazed that in our teaching clinic or in our practice in England, we get heavy pathology on the one hand, on the other hand, extremely emotional cases, depressed, emotional, antidepressant dependent, and we can put that in the right direction by selecting a correct medicine, and that's possible. Sometimes we give support with organopathic medicine, which we had discussed, like example of verbena, etc. And in that way, my homeopathy is more like a medical homeopathy. Like, I do not believe homeopathy is a complementary medicine. I believe homeopathy is an alternative medicine. We run at parallel. We run shoulder to shoulder with conventional doctors. And what they cannot do, we can help. And that's the way I practice. That's my practice in India. That's my practice in the UK. Because when the patient comes, he's heavily drugged, he's drug dependent. My first aim is to give him some relief in gradual weaning of the medicine. Of course, if the patient wants, because if the patient's consent is important. And I try to show this within couple of months period, maximum three months period, that I tend to withdraw a little bit of medicine. And you can do it with homeopathy, what I was sharing today in the lecture.
Okay. Last question about depression. Our winter edition is about depression. You said something about miasms and depression. Okay.
Depression is a broad topic, and obviously depression can progress to quite extreme. Today in my lecture on the miasms, I said just hopelessness, which is lack of hope, sadness, transient sadness is sora. Whereas when that goes to the extreme, we have destruction of hope, we have melancholia, we have depression. What the conventional doctor says clinically depressed, that goes to syphilis. And along with that depression, clinically depressed, when that is associated with dissatisfaction, when that is associated with extreme degree of impatience, tubercular miasm joins in as well. So basically, extreme depression is either syphilitic or tuberculosyphilitic. And we have very many medicines. We have, you know your polycrest, we have Natmur, Aurum metallicum, carcinosin, Calcaria fos, etc., causticum, etc. But also I use sometimes when the patient is totally depressed and on antidepressant, having antidepressant every 8 hours, 3 times a day, you do not have a clear picture. I give supportive homeopathic medicine, like lesser known organopathic medicine, what I call, like verbena, like tanacetum, like iris. I also prescribe like califos, camphor monobromatum, things like that have the capability of gradual weaning off of the antidepressant. And say the patient was taking 8-hourly medication, if I can wean off to 10-hourly, that means I'm getting 15% weaning off, and gradually I wean off, generally with 30% weaning off, the natural disease surfaces, and I go for a polycrest. So I regard my polycrest, wait a little bit, try to get a clear picture, and then I go for the kill. And that's always possible if you know your miasm and if you know your metromedica, and you can do that. And I always depend on my old medicines. When I say old medicines, I mean medicine mentioned in the Banerjea, medicine mentioned in the old literatures. I never prescribe new so-called medicines, which even are not sometimes well proved. So I depend on the old literature, and I prescribe on that. And I think I am one of the person, there are many people in India, but I'm one of the person who treat very many heavy pathology. I welcome you to have a look in our website, There are 75 well-documented cases, cases with treatment before and after, and you can see what homeopathy can do. Thank you very much. Thank you.
The website is?
www.homeopathy-course.com, and that's the website. And I'll give you a CD on the thing. You can put the some of the cases if you like. That's in the CD as well.
Okay.
Thank you.
Thanks a
Thank you
lot.
very much.